1 year into President Trump's second term in office, Americans remain concerned about the economy, with the cost of health care topping the list. According to a new KFF Health tracking poll, two-thirds of those surveyed say they worry about being able to afford health coverage. More than half say costs have gone up in the past year. And a majority, 56%, say they expect health care costs for themselves and their families will be less affordable in the coming year. Renuka Rayasam joins us now to break down what options you have. She's a senior correspondent at KFF Health News. Renuka, thanks for being here. Talk us through some of the reasons why Americans are feeling the pinch, and is there any relief on the way?
Yeah, absolutely. There's a few different reasons why Americans are just feeling the pinch of higher healthcare costs this year. Number one, the Congress didn't enhance subsidies for ACA premiums this year. And so on December 31st, those enhanced premiums that were put in place during the pandemic lapsed, and people's subsidies sort of reverted back to pre-pandemic levels. And that means for a lot of people, they saw their premiums skyrocket. So I've talked to a few people who said, one woman who said her family's premium was going to be more than her mortgage, and so she dropped health coverage altogether.
Wow.
Another woman in Tennessee said her premium for her ACA plan jumped tenfold, and she was going to have to drop coverage altogether as well. And so a lot of folks are feeling the immediate cost of that. But healthcare costs overall are rising, and that's true for people whether they're in Affordable Care Act plans or whether they have employer-sponsored coverage or whatever type of coverage they have. Healthcare costs have risen sort of 26% this year, and that's due to a variety of factors. So a lot of people like to blame insurance executives; they get the brunt of the blame. But the reason costs are rising is that healthcare is just more expensive. So higher hospital costs, GLP-1 drugs like Ozempic are pricey and popular, and that's driving up costs in healthcare plans. And people are dropping insurance, and that's also driving up costs for the people who are left in these insurance pools.
And so what can people do if they find themselves uninsured or unable to afford their premiums?
So all of the analysts I talked to said, number one, do everything you can to find coverage, even if you have a plan that has a low premium and a high deductible. That means like high out-of-pocket costs. Try to do that first, because that will protect you in case you have a really, really big bill, a big emergency. Okay, barring that, so you don't have insurance, you find yourself without coverage for the year, there are a few things you can do. Number one, talk to your doctor. A lot of people may be embarrassed to talk to their providers about the fact that they're paying out of pocket, but a lot of providers offer cheaper cash pay options, and they might kind of shuffle around how they do your treatment plan. So they might order an ultrasound, which is less expensive, instead of an MRI. The doctors we've spoken to said they're not going to skimp on care, but they might just kind of rethink what they do. If that doesn't work, if your doctor's not willing to budge there, then head to a place that is used to treating uninsured patients. So these are your federally qualified health centers, your community health centers, places like that are used to this. Another thing to think about: if you get a prescription or you have a prescription, don't just head to your local pharmacy. Shop around. So it's easier to shop around for drugs than it is for doctors. You can go to your big box retailers like Walmart, Costco. A lot of these big box places will offer generic versions of your prescription, or there are sites that allow you to comparison shop, or you can go to the drug maker's website themselves and look for coupons and discounts. So there's a few different things you can do. That's just some of the options we've outlined in our story on this.
A little bit of legwork, but we appreciate it. Renuka Rayasam, thank you so much.
Thank you for having me.